Good afternoon. It is great pleasure to welcome today Dr. Sayuri Matsushima, a dedicated colorectal surgeon at Matsushima Hospital in Yokohama, one of the largest proctology-focused hospitals in Japan. We are truly honored to have her with us today as part of the Y-ESCP campaign, spotlighting global perspectives in colorectal surgery. Dr. Matsushima, sincerely thank you for taking the time to join us and share your insights.
Thank you so much.
So I would like to ask you, what are the core objectives of the Japanese Society of Coloproctology, the young part, and how do they support young colorectal surgeons in Japan?
Okay. Uh, First of all, there is no young society in Japan. One possible reason for this is the age of the group of obtaining membership or becoming a specialist in JSCP is higher compared to other societies. In the typical Japanese system, if everything goes smoothly, one becomes a doctor at around 24 to 25 years old. Around the second or third year after becoming a doctor, they join a medical society related to their field, such as international medicine or surgery. In Japan, many young doctors decided to specialize in fields like gastrointestinal or cardiovascular surgery by the time they join the surgical society. As a result, they often become membership of subspecialty societies, such as the Gastrointestinal Surgery Society, early in their careers. On the other hand, within gastrointestinal surgery, the decision to focus on specific areas like colorectal or anal surgery usually comes after gaining experience in general surgery. As a result, the peak age for new members joining the JSCP is between 31 and 35 years old, indicating a higher age demographic. Furthermore, the average age of a successful candidate for the JSCP Broad Certification exam is over 40 years old. This higher age distribution may contribute to absence of a young society with the JSCP.
Yeah, now I understand. Now it makes sense. You get specialized at a much higher age than average. I would say in Europe. For
Mhm.
us, young ACP, usually it's less than 40 years old.
Mhm.
So that brings me to my second question. What are some of the biggest challenges that are faced by young colorectal surgeons in Japan
Okay.
nowadays?
The primary challenge faced by young colorectal surgeons in Japan is a shortage of manpower. Many JCP members are gastrointestinal surgeons who also get JCP certification as a specialties. But over the last 20 years, the number of gastrointestinal surgeons has dropped by about 20%. It is being pointed out that there is a possibility of a shortage of colorectal surgeons in the future. The main reason for this decline include long working hours, heavy responsibilities, and relatively low salaries. According to a survey by the Society of Gastrointestinal Surgery, many surgeons are dissatisfied with their current working contribution and salary, making them hesitant to recommend this career past their juniors. In response to this situation, the Society of Gastrointestinal Surgery established the Under 40 Committee, targeting doctors under 40 years old. During academic conference, they organizing similar young doctor to topics such as scientific and surgical techniques. But now JCP don't have such the same young society.
I see, I see. That's really interesting, and I think it's international phenomenon. It's not only in Japan. I think worldwide we have a shortage of general surgeons and also colorectal surgeons. I think needs a lot of dedication, and the younger generations value other things most rather than our generations.
Mhm.
And in your opinion, how does the Japanese Society of Coloproctology encourage research, training, and skill development among its young members?
Okay. The JSCP has a training program called the Traveling Fellowship in partnership with the Y-ESCP. It's open to JSCP members under 45 years old and gives them a chance to attend ESCP scientific meetings and train at top institutions abroad. But for many Japanese doctors, including myself, the language barrier, especially with English, can make it a little bit difficult. Additionally, JSCP also offers a board certification exam. While it's not directly focused on hands-on skills, it shows that a doctor has specialized knowledge in coloproctology.
Yeah, and I think this is really important. We're trying to implement also the European board certification in Europe as well. And although it's
Mhm,
not necessary to have it, it really indicates that you are a specialist in the field.
mhm,
And I think any serious coloproctologist in Europe should have this board certification. Um,
mhm.
More or less you described, but are there any specific programs or initiatives within the Japanese Young Coloproctology Society that have been particularly impactful to the young?
I believe the traveling fellowship with the ESCP is the most impactful program. I was able to get this interview invitation from Dr. Zoe myself thanks to the traveling fellowship. I think it's a great program that gives young doctors in Japan, even those who aren't very active internationally, a chance to connect with doctors overseas. Last year, when I was 35 years old, I was elected vice president of the JSCP's annual meeting. It was a big honor for me, but honestly, I believe there are many other young doctors who are worked even harder and truly deserve recognition. I think it's important to create more chance for these talented individuals to share their ideas and take part in leading the society.
Huge congratulations for this, and indeed it was an honor for me to be there at that meeting. It was one of the best meetings I had attended in my life.
Mhm.
Really succinct, really educational, and very hospitable, the Japanese Colorectal Society. I wanted now to ask you, what is the pathway for becoming a colorectal surgeon in Japan?
In Japan, the first step to becoming a colorectal surgeon is getting board certification in general surgery. Many colorectal surgeons work in general hospitals. Proctologists also often work in general hospital, but some work in specialized proctology centers like me. To become a colorectal surgeon in Japan, training at a large hospital is usually required. However, there is a current no well-established education system for becoming a proctologist. It's not a formal training system, but the JCP offers a board exam that acts as a certificate to show you are a qualified specialist in colorectal care.
I
That's
see.
all.
I see. I see.
Mhm.
Um, I think pretty much it's similar to some of the pathways that we have, although the downside in Europe is every country has its own pathway of becoming a colorectal surgeon. While in the US that I'm currently residing and doing my fellowship, it's more straightforward for all states. They have one pathway for everyone. And it's pretty similar to Canada as well.
Mm.
Now, from your perspective, what are the benefits of international collaborations between young colorectal societies?
Mhm. Um, Many Japanese surgeons, including young doctors, often find it challenging to communicate in English. The demands of their daily schedule leave little opportunity for language study. International collaboration opens our minds and helps improve research, writing, and clinical skills. Of course, these are challenging, but facing them, especially early in our careers, helps us grow, I think.
Here's to what you said, I completely agree. So, how do you see the partnership between the Japanese Society, the Young European Coloproctology Society, the American Society, benefiting young surgeons globally?
Um, Taking part in international programs like ESCP's Global Reach gives young surgeons the chance to connect with researchers from other countries. It's a great learning experience and also helps improve the quality of research back in their own countries, I think.
You're right. The global reach is really helpful, and I'll agree with you. Now, we said there are some difference between, Europe, Japan, US in terms of training and practice. What lessons from the Japanese surgical training and practice do you think could be valuable to young surgeons in other countries?
In Japan, we have a public health insurance system that covers everyone. No matter where you go, medical costs are same. Because of that, there is a strong expectation that all surgeons provide the same quality of procedures. So having standardized techniques is very important. For these reasons, there is a certification system for laparoscopic surgery. A video is submitted, and in the case of the colorectal field, the surgical techniques for sigmoid colon resection or high anterior resection are assisted in the examination. In Japan, this certification is often considered essential to be recognized as a laparoscopic surgeon. I'm not certain whether it could offer any insights to other countries, but I believe this system is characteristic of Japan.
Yes, this is fantastic. And really, when I heard about it while I was doing my fellowship there, I was in awe. It's really fantastic, and I do think that it will make a difference in other countries as well. Also, I really much enjoyed the fact that you have a database of videos from all surgeons, and then you can learn from one each other. This is fantastic. Now, what is your vision for the future of the young colorectal surgeons in Japan and globally?
In Japan, the number of gastrointestinal surgeons, including colorectal surgeons, are decreasing due to low salaries despite long working hours and heavy workloads. If things keep going like this, there is a high risk of a collapse of the healthcare system. Similar trends are observed in other countries, such as South Korea, suggesting that this issue may not be unique to Japan. So, by sharing ideas about healthcare systems and policies between countries and encouraging young doctors to connect internationally, we can find helpful ideas and solutions. These are my thoughts.
No, 100%. This is a very hot topic, and these are pearls of wisdom you just shared. I think we should collaborate internationally because it's a matter of years to have this problem in our hands. Dr. Matsushima, thank you so much again for this thoughtful and inspiring conversation. Your experience and commitment to advancing our field, both in Japan and through international collaboration, are truly appreciated. We look forward to many more shared opportunities ahead. And to our audience, stay tuned as we will continue this exciting series, bringing you voices from young colorectal leaders from around the world, leading to Tripartite 2025. Dr. Matsushima, sincerely thank you again.
Thank you so much.